May is Save Your Teeth Month. Today I have Stefan Zweig, D.D.S., President and American Association of Endodontists. How are you, Stefan?
I'm good, James. Nice to talk to you.
Nice to you too. Endodontist is a word I got to get used to saying. Let it roll off my tongue. So forgive me on that one. What's the difference between an endodontist and a general dentist, and when do you know when you need an endodontist?
Yeah, so an endodontist is a general dentist. Well, it's actually a dentist who's received an additional 2 to 3 years of training in the diagnosis of dental pain, in doing root canal treatment, and actually helping patients save their natural teeth. So whenever you have pain, there's a good chance that you'll need to see an endodontist. Endodontists are specialists in diagnosing that pain and giving you alternatives to save your natural teeth. Some patients go to general dentists first, but general dentists refer to endodontists to do root canal therapy or do root canal treatment. And also, you can actually self-refer yourself to an endodontist if you have one of these problems.
Now, what should you do if you crack a tooth or have mouth pain?
So the first thing is that, we're seeing a lot of cracked teeth today. And it's big, we've actually seen an increase in cracked teeth over the last 20 to 30 years, but we're especially seeing it over the last couple of years during the pandemic. People were unable to visit dentists, and also people are under a lot of stress and have, grinding their teeth or doing other things that, lead to cracked teeth. The good news is that when you have a cracked tooth, you can actually many times save your tooth. But a lot of times cracked teeth produce pain in teeth. And the reason is because the tooth is, the nerve in the tooth is damaged. And so that's when endodontists come in, that's when root canals come in. So a lot of times, and this happens very frequently, there's pain associated with cracked teeth. And we encourage people to see endodontists because they can actually help reduce, get rid of the pain and to help treat the tooth and save the tooth.
Now, why do endodontists support saving our natural teeth?
So at the end of the day, there really is no replacement for your natural tooth. The loss of a tooth can be very devastating. It could lead to loss of function, the way you eat and chew. It could also lead to problems that you don't even think about. In other words, it could actually affect your appearance, which affects the way you relate to people, and it could also affect your job. So, saving a tooth is really the way to go. The loss of a tooth requires the replacement of a tooth many times. And replacing teeth with other means can be very difficult, very time-consuming, very expensive. So if you can save your tooth, that's really the best way to go. And that's why we advocate for saving teeth.
Now, what preventive care can people take to avoid a dental emergency?
Well, good dental care really starts at home. So of course you want to brush your teeth, 3 times a day and floss your teeth, and just be generally aware of your oral condition. We like to say at the American Association of Endodontists that no pain is normal. And so even if you have minor pain, you want to visit a dentist because it might be the sign of an early sign of something that's much more significant going forward. So we do recommend that you see your dentist twice a year for professional cleanings and for checkups. Many times small problems can be dealt with early and easily, but when things become more advanced, you get deeper cavities or trauma to teeth or things of this sort which cause the pain, then you may end up needing root canal treatment. The good news is you can save your tooth, but you need to see the right person, and we feel that an endodontist who has the expertise in doing this type of thing is really the person to see.
Seth, you have no idea the fear I have of dentists. And when you say the word root canal, it sounds like Freddy Krueger to me, but I'm sorry about that.
Yeah, so I mean, your story is pretty common. There's a lot of stories out there circulating about root canal, but But here's the good news, the root canals that we do today are a lot different than the ones we did, 20, 30 years ago. We have a lot more expertise, a lot more knowledge. We have better anesthesia. We have better techniques. We have better technology. And so most root canals are done very, very comfortably, very efficiently. It's many times done in one visit. No pain during the procedure, very little discomfort afterwards. So, things are not the same as they used to be.
Thank you for that. I needed to hear that. Now, where can we get more information about root canal treatment and to find an endodontist nearby?
Sure. So we have a website, and it's findmyendodontist.com. And on that website, you're going to find a lot of information about root canal. You're going to find information about what endodontists do. You're also going to find a search where you can actually put in your own location and find an endodontist that's very close by to you. So we really encourage people to use that website. There's a lot of great information on there. And again, it's findmyendodontist.com.
We've been talking with Stefan Zweig, D.D.S., President of the American Association of Endodontists, and he has relieved my fears of Freddy Krueger in the dental office. Thank you again, Stefan.
Thanks a lot. Thanks for talking to me.
From our roots in St. Louis.